Right, well, good afternoon, everyone, and welcome back to this session of this conference, which I have to say I want to start by congratulating the GMC team. Fantastic support for everyone, and to thank IAMRA for their work to make this such a successful event. I'm Harry Cayton. I'm the Chief Executive of the Professional Standards Authority for Health and Social Care here in the UK. I'm going to chair this afternoon's session. And I just want to tell you that we're really keen that this should be an interactive session, that there should be as much discussion and debate as we can manage. There are two breakout sessions for you to talk in smaller groups, and there are two discussion sessions during the afternoon, and you'll be pleased to know there's only one and two small presentations. So we're trying to make it an afternoon that you can engage with. I have working with me this afternoon on the panel and on the presentations, Elliot Rose from PA Consulting, Margaret Mungherera from the World Medical Association, and of course Malcolm Sparrow, who you heard this morning. I have to say Malcolm's presentation was, as I think we'd all agree, quite dazzling and wonderful. I was asked recently, this is my only claim to some association with Malcolm, which he doesn't know, but I was asked to speak at a conference in the United States on regulation, and the organisers said to me, "We're only asking you because we can't get Malcolm Sparrow." So now I know where I sit in the world regulatory pecking order. So I'm going to just talk to you briefly about right touch regulation. I'm sure some of you will be familiar already with the work that we've done in this area, and I'm going to get through it, I hope, relatively quickly. This afternoon is about the fundamentals of regulation. I'm going to focus on the fundamentals of right touch regulation. And I just want to stress absolutely that word has an R in front of it, not an L. It is right touch regulation, not light touch regulation. And it's different, and I will explain why it's different, but it is sometimes misunderstood as being something similar to light touch, which it certainly is not. So yesterday, Peter Rubin, in one of his comments, said if you're starting from scratch, from the fundamentals of regulation, keep it simple. And I thought, well, that's one of the 8 principles of right touch regulation. So let me just remind you of that, and I'm going to try and keep this presentation simple as well. And I think also from what Malcolm said to us this morning, there's a key message there about being very clear about what it is you want to achieve. Because creating a regulatory system is not an end in itself. It is only a means to an end. And we're very often very unclear as regulators as to what outcome we're actually trying to achieve. We get terribly excited. You know, it's in the nature of regulators to love process. We love designing systems. We love thinking of standards that we can measure people against. But all that is relatively futile if you're not clear about the outcome that you're trying to achieve. And for most of us, that outcome is very clearly and very strongly patient safety and public protection. But there may, for some of you in other countries, be other outcomes you need. One of the outcomes you might need to build is a coherent professional body, is a sense of collegiality amongst health professionals. Those are things that are legitimate outcomes, but you need to be clear in your own minds about what it is you're trying to achieve. So this is my little simple definition of right touch regulation. It's based on a proper evaluation of risk, is proportionate and outcome focused, and it creates a framework in which professionalism can flourish and organisations can be excellent. I think it falls horribly into Malcolm's expert model of regulation. The definition of excellence there is drawn really from Aristotle. It's the idea that excellence is not a state of being, but a state of activity, a continuous improvement of good practice. My colleagues in the regulators here in the UK will recognise with sinking hearts that we often in our performance reviews say to them, that was good practice, and then the following year we don't. And they say, but you said it was good practice last year. And we said, well, it was last year, but it's not this year if you haven't improved on it yet again. So it's quite a tough challenge, that definition of excellence as a moving target. But it also means that you can be excellent at any stage of your development because you're setting the targets for yourself to achieve. I use this symbol really as a very simple way of explaining what I mean by right touch regulation. So some of you may be modern and have digital scales, but I've got these lovely old brass ones that I inherited from my mother. And what you do is you put the weight in one side and it goes down, and then you start pouring whatever it is, flour or sugar or whatever, into the other pan, and nothing happens. And you keep pouring and nothing happens. And you keep pouring, and until you get to that moment when you have exactly the right amount to balance the weight, the pan tips and balances. And if you keep pouring again, it goes down and nothing happens. In other words, right touch is exactly the amount of regulatory force that's necessary to achieve the desired effect. Too little does not achieve any effect. Too much is a waste of effort and resource. So that's what we're looking for in the model of right touch regulation, and that will depend entirely, the right amount of regulatory force will depend entirely on the amount, on the complexity of the problem we're trying to solve. So it's important to remember that we are not alone. Regulators do not operate in a vacuum. They operate in an important social context. And we think there are 5 key agents working in most systems towards improving quality. We've got the regulators themselves, but we've also got the framework of the law, which includes health and safety law, employment law, all the other things that make our social fabric work. We've got the professionals who are making the decisions on a daily basis as to what happens and what doesn't happen. We've got the employers who are responsible for the quality overall of the service that they deliver and the management of the people and objects that work in it. But most importantly, I think, we've got service users, patients, the public. Over-regulation disempowers the user of the services. Over-regulation makes us feel safe when we're not. Over-regulation stops us making choices for ourselves, stops us being awake. There's lots of evidence in hospital safety that if you allow patients to challenge and engage with the health professionals, they will often be the people who can say, actually, you're giving me the wrong medicine because I know the box is yellow and you're giving me the blue one. They will say, I know my child is not well, you're not listening to me, I know my child better than you do. It's really important that we don't disempower the service users by saying, don't worry, we the regulators, we the professionals have sorted it all for you. We want service users who are keeping us on our toes because they have the greatest interest of all in safe and effective care. So those 5 elements will vary in their importance according to the regulatory or risk problem we're trying to solve. Sometimes regulation will be the wrong solution, it won't be important. Sometimes it will be a key element of the framework of creating quality. But we should always remember as regulators that we're only one element and a very important part of how quality is created in healthcare. And that's important too, because of course, as many of you know, when a problem arises, governments tend to reach for their regulator. And the regulator gets blamed for things that it wasn't responsible for, and regulation gets used to solve problems that it cannot solve. So there are these 8 elements of our right touch approach, and I'm going to go through them relatively quickly. We have a few copies of right touch regulation with us, and my colleague Dinah over there has them if you want to ask for one. And that goes into this in more detail. I should say also that Dinah's running a project for us at the moment to review right touch regulation. We've always considered it a work in progress. We published it in 2010, and we've had lots of very positive and useful feedback from people in the regulatory world, and we're currently kind of rewriting it and refreshing it and thinking about what we've learned as a consequence of the many discussions we've had with you. So again, any ideas that you have after this session that you want to feed into us, we'd be really grateful. So here we go. Identify the problem before the solution. It's a bit obvious, but it's very rarely done. Most government policy starts with a solution for which the government asks you then to find a problem to fit what they've decided to do politically. So I think that's a really, really important point, and we're always asking ourselves and others, so just what problem are you trying to solve here? Because you might well find that regulation is not the solution in any way. Secondly, quantify the risks. And I use the word quantify because I think we're really good at describing risks, but we're really bad at quantifying them. And we're also very bad at assessing what our public tolerance for risk is. And the public, I think, have a pretty good tolerance for risk. And I don't think the public are anything like as risk-averse as politicians like to claim. What the public are averse to is risks they think they don't have a stake in. So we take much higher risks when we're driving a car because we think we have a stake and in a control of the risk than we take when we're flying an aeroplane when someone else is in charge or on public transport. And I say this is a rather shocking example, but I use it deliberately. If you say to a politician, how many dead children will you accept? A politician will always tell you that there is no such thing as the acceptable death of a child. So will you tell me then why in the UK we still have over 300 children killed on the roads every year because we're not prepared to put that level of regulatory force into our control of drivers? We could stop many of those deaths by higher speed limits, or as one person once suggested to me, by putting a very large sharp spike 6 inches sticking out of the centre of your steering wheel. That would slow the drivers down quite considerably. So we, as a society, I'm not blaming the politicians here, have accepted a level of risk. We're not saying it's desirable that those children should be killed, but we tolerate a certain level of risk. So in different industries and different situations, we tolerate risk, and it's really important not just to describe the risk, but to quantify it. Get as close to the problem as possible. The regulator is never in the room when things go wrong, so it's really important for us to remember that the problem exists, usually in healthcare, as an interaction between a health professional and a patient, or between 2 health professionals or more. That's where the problem exists, and the people who are most likely to be able to keep that patient safe and solve that problem are those people, not the regulator, not the writer of guidance. My colleague Douglas was talking about our work on looking at the multiplicity of guidance, the thousands and thousands of overlapping and conflicting bits of guidance that health professionals are given. So get as close to the problem as possible. Always focus on the outcome. I've mentioned that. Use regulation only when it's necessary. Keep it simple. And check for unintended consequences. Every regulatory action has an unintended consequence. Now, because unintended consequences tend to be random, sometimes unintended consequences are better than the intended consequences. But that's only luck. Usually they're not. And let me give you a couple of simple examples. Very good editorial in British Medical Journal a little while back on whether there was an evidence base for the British Medical Association's support for compulsory wearing of cycle helmets. And one of the things they found looking at the evidence was that there is quite clear evidence that cyclists wearing cycle helmets feel safer and therefore take more risks, and that motorists seeing cyclists wearing cycle helmets think they're safer and drive closer to them. They give a wider margin to cyclists who are wobbling and not wearing helmets and talking on mobile phones than they do to cyclists who are storming ahead on their fast city bike with their helmets and their flashing yellow jerkins and their red lights. So actually wearing a cycle helmet increases an element of risk. However, you might then say, well, fair enough, if you get knocked off, at least you're wearing a helmet. Well, in fact, most cycle injuries are not head injuries, they're crush injuries because the cyclist is pulled onto the wheels of a truck or a lorry. So their conclusion was not that it was a bad thing to wear a cycle helmet, but that the evidence that wearing cycle helmets makes cyclists safer is pretty shaky. And it's just an example of how if you change one thing, like forcing cyclists to wear helmets, you will change the behaviour both of cyclists and motorists. So unintended consequences, I think, happen all the time. And I think we're quite poor at thinking through the what-ifs. If I regulate this thing, what will happen as a consequence? And it often won't just be the regulatory intention that you had. And finally, review and respond to change. Regulation tends to static. It tends to kind of freeze things. And it's very important that as regulators, we are constantly asking ourselves, are we doing the right thing in the right way? Should we change it? What circumstances have changed as a consequence of the decisions we've made? I mean, if you think about the huge impact that revalidation is having on doctors in the UK and on how they behave, I'm quite sure the GMC will be revisiting the whole revalidation framework over time because it will have introduced changes in its own way. So I mentioned the scales. This is it's always good to have a first law. The problem is I never really thought of the second or third laws there. I've got a couple of them, but this is just an important message around this is right touch regulation. It's only the regulatory force necessary to achieve the desired effect, but it is regulatory force. It doesn't mean doing nothing. I just want to put this in a bit of context. We've been talking a bit about a continuum of assurance. In the UK, we've introduced a accredited registered system for unregulated professions. We also have codes of conduct for staff, which are employer-led, and we have, of course, statutory regulation. So I think more countries are increasingly looking at this continuum of risk, trying to understand where the risks fall, and designing regulatory systems that are appropriate to the level of risk that a particular occupational group might have. And I think we need to do more about what we need to move away from is the idea that somehow it's good for everybody, regardless of their occupation, to be down the right-hand end of this scheme. It's very expensive, it's very, as I say, frozen, it's very hard to change. And regulation is not about increasing the status of professional groups. That's one of the problems we have. People love the idea of being regulated. Well, I'm not regulated. That's because I'm not a professional. I am an honest tradesman. I'm a manager. A manager is an honest tradesman, in my view. And God forbid we start regulating managers, because we'll all have to have MBAs, and then where will we be? Just to finish up, really, we've worked on this concept of different regulatory different regulatory schemes having different force, and I just use this slide because it seems to me illustrates very well some of the things that I'm talking about. So, for instance, if you look at this, you can see that even the floor has been regulated because there's a yellow line on it, and there are two different coloured areas, and they mark where the trucks can and should go and where the storage can and should go. The pallets are regulated. The wood, the strength, the size, the construction of those pallets. There's even I was delighted to discover a disciplinary body in Canada that deals with pallet infringement of pallet rules. You can be struck off by the disciplinary body for selling cheap pallets, and that's actually a good thing because they're dangerous, and if they break, people could be seriously hurt. The forklift truck itself is fantastically well regulated, including the weights on the back of it, which can be changed and altered according to the weight that's being lifted. The most difficult thing to regulate in that picture is the bloke who's driving the forklift truck, and that's what you have to do, and that's why professional regulation is in fact highly complex, because we're not dealing with inert objects who can be designed and told what to do by physics. We are dealing with human beings who are not very good at being told what to do. And interestingly, when I was looking for this photograph on the internet, I found a photograph of a forklift truck being driven by a small child. I didn't show it to you because I thought it might be rather invading of somebody's privacy. But it's quite an interesting thing that demonstrated to me that the one thing it's most difficult to regulate is the people. So I'm going to finish at that point. I hope that's given you some food for thought for the discussions that we're going to go into. But I'm going to ask two people to come up and just add to my thoughts with some comments of their own. First, I'm going to ask Elliot Rose from PA Consulting. PA Consulting in the UK has done a huge amount of work on regulation and has worked with a number of our key national regulators, including the GMC. So Elliot, welcome. Elliot will come up, say a few words, and then join the Q&A session. Thank you.
Thank you very much, Harry. I just want to talk for 5 minutes, and I thought it was useful just to spend those few minutes just talking about some research that PA's been doing recently, looking across different regulated sectors. As Harry mentioned, we work in health, but we also work in other sectors. One of the things that's really interesting to us is looking across different sectors and seeing where there are areas where those sectors can learn experiences and knowledge and share that for the overall good of the people they regulate. Harry talked earlier on about the fact that regulators love their process and love rules. And I think one of the things we've looked at in terms of looking at surveying of various firms that are regulated and those that regulate them is that a lot of firms tend to sit around what we call our maturity curve, the middle point of that maturity curve. So a lot of regulators have moved up from where they are in terms of being ad hoc, and they have really strong rules and process-based ways in which they work. The one thing, though, that as we've talked about, is outcomes is becoming more and more increasingly important. And if we look, no matter whether it's financial services, other sectors, healthcare sectors, pharma, actually what we find is that where those regulators and those they regulate have accepted about ways of working around outcomes is a far more positive way, not only just in terms of better outcomes for the people that they deliver services to, but they also in terms of shareholder value, in terms of the bottom line, in terms of the value add to the business. So it's quite an important finding on that. The one thing, though, that we do find that's, that the really important part is why is it? What's the key ingredients to getting successfully based on outcomes-based approach? Yes, there are ways in which you can go about that and things you can implement. But one of the key things that I believe is around collaboration. It's having that good, strong collaboration with those that you oversee, but also collaboration as a regulator with other regulators and other stakeholders, government bodies, for example. So looking at the surveys we've done, looking at the work we've done, what I tried to pull out for this afternoon What are the key ingredients of success in terms of looking at around making collaboration business as usual for regulators? The first point there is about having a clear and common purpose, about being absolutely crystal clear with those you regulate and expecting back from them what they expect from you as well. And so you're seeing a number of outcome-focused regulators, I think, that have been very successful, have been very clear with those they regulate, what are the rules and regulations and where they're going to regulate them. So the Prudential Regulation Authority here in the UK, that the organisation looks after financial institutions here, actually publishes a framework, an intervention framework of how they're going to work with those they regulate, and also importantly, how they're going to intervene. Now, as a regulator, they're not going in there to actually save firms. They actually see failures of firms as good business, as life cycle of business. But what they want to do is they make sure that when those firms fail, they fail in a safe way. They don't damage or harm those people they provide services to. So a very interesting way of being very open and proactive about it. And others are that way as well. The Solicitors Regulation Authority that looks after solicitors here in England and Wales also publishes actually how they risk score and assess the firms they're looking after. So that's the first one. The second one there is about having the right levels of engagement and avoiding the sort of compliance as bolt-on function. All too often, perhaps not the less far-sighted organisations tend to look at compliance and create a function around it. I think where we see true success is where you see cultural acceptance. You see where everybody in an organisation that under a regulated sector is actually culturally aware of the things they're looking out for from a regulation point of view. How do you achieve that? Well, certain industries, I think people like Civil Aviation Authority have been very good about reaching out to those people, flight crew that operate in the UK here, about helping them. So they're engaging with them, not just to be punishing them, but actually helping them. If they have problems, they encourage them to come to them on a voluntary basis and support them to their issues. And I think we talked this morning about how do you manage that interaction effectively. Well, some of the things we're seeing is about using more digital channels. Face-to-face is really important, but with the way things are moving in terms of digital channels, social media, there's a lot more I think regulators could do in that area to actually increase that engagement. We talked about information this morning, and I used the term dare to share. My experience of regulators is they tend to have a lot of information in lots of siloed areas. And to be able to pull that information together in the past has been very difficult to do that. I think somebody referenced it earlier. But actually now with the advances in technology, things like Google BigQuery, the fact you've got cloud-based technologies, it's very easy to pull that data together, to look at it, and to do compare and contrast across it. And it's really surprising when you start to do that and pull data together. I think we talked about it earlier, spotting the false positives, identifying the issues in that data set. But it's not just about the data in the organisation itself. It's about pulling the data from other sources, other parties, other data sets. Increasingly now that you're seeing access to public data sets, such as social media, blogs, forums. Interestingly, for example, the Solicitors Regulation Authority have got not only a reactive arm, but a soft intelligence arm now. So they will go out and they'll look at all kinds of data sets, and they've spotted the fact that solicitors, if there's a correlation between a good solicitor's firm and a bad solicitor firm, based partly on how they run their finances. So they look at things like county court judgments, they look at tax records, things like that, trying to build a big intelligence picture up about those firms so they can be proactive, but also focus on those firms that are really important to look at. And finally, I think it's also important about being seen to be at the centre of innovation. Civil Aviation Authority and also the Federal Aviation Authority in the US are now much more focused in terms of actually facilitating networks of sharing of information. So the FAA in the US don't have access to the detailed data, but they've created the infrastructure to allow flight operators to actually upload their data onto a system they provide. And that's driven almost a league table of performance in terms around safety. It's also been done in association with the pilots' union. So again, trying to allay fears or concerns about how these regulate. You're not spying on them. You're generally using this data to actually try and improve and be provide a safe environment to operate in. And again, I say there's more international cooperation. Talking about collaboration, there's much more link up internationally because obviously airlines fly in and out different countries, of actually making sure we make safer skies for the whole of the world. So those are the sort of 4 things I thought were useful to reflect on. We've got some breakout sessions later on this afternoon. We'll talk about them in more detail. If anybody would like more details about the research we've done across different sectors, then please see me afterwards and I can point you in the right direction. Thank you.
Thank you. Always something ominous about the phrase, please see me afterwards. Right, my pleasure now to welcome Margaret Mungherera, President of the World Medical Association. Margaret's a very distinguished doctor, both in her own country and also in international work. And we're really pleased to have you with us, Margaret, and please share your thoughts with the audience. Thank you.
Thank you very much. Just speaking from the professional's perspective, and maybe some of the issues that we need to be thinking around, perceptions of health professionals as regards regulation. Many times professionals do feel as if they're being, that they should be protected more than the patient should be protected. And I think that's one thing that we need to be looking at, trying to address that as a challenge. But also the environment in which health professionals do work, especially in areas where we have limited resources. We're talking about some parts of the world where brain damage, sorry, I'm a psychiatrist, so I'll talk about brain damage. Brain drain has been massive, and these shortages all around, not only in human resource, but shortages that health professionals work under. And the whole political environment, the socio-economic environment under which health professionals work. But also trying to get health professionals to understand that the patient should be the center of care, and that the patient, it should not be disease-centered care, but patient-centered care. And therefore making sure that health professionals are aware of their ethical obligations. And therefore that's a lot of work that, again, may not be the regulators to do that, but looking at how the employers and organized groups of professionals like the associations could be, a bit more involved in that. The role of traditional, cultural, religious issues that play a role, especially in some parts of the world. If you look at Africa, you look at Asia, you look at South America, and increasingly in the Europe and in the Western world, and the need for us to start thinking that in some parts of the world, like we talk about those parts of the world where actually traditional medicine is actually, it is the conventional medicine, and actually the rest of us are practicing alternative medicine according to the population out there. If you look at Africa, for example, 82% of the people in Africa will go first seek care from a traditional practitioner. And governments in Africa have resolved that they should regulate or integrate traditional medicine into the national health systems. But again, it's the perceptions that we need to be looking at and trying to address and managing the change that will happen. Now, of course, the whole issue as professionals, one of our concerns or our fears is as we move into the information age and we are building our information societies, as they say, with this promotion of developing of ICT, the public is bombarded sometimes with information that we should be managing, and therefore it is one of the concerns that we have that we need to manage that. So a lot of work needs to be done outside the regulators and outside the profession, a lot of issues that need to be addressed, but a lot of issues need to be addressed by professionals ourselves. And just to sort of finish and say, well, there's a lot happening out there, even in low resource settings. And we are quickly moving with globalization, we are quickly moving towards the same standards. As you see the collaboration on the African continent, in Asia, and the collaboration and networking. And as we move to sort of universalize the standards, there's a lot out there that we need to be able to look at and see whether it's evidence-based, and maybe do a bit more research and see what impact that might have as we move in that direction. Thank you very much.
Perhaps I could also now ask Professor Sparrow to come and join us. So many of you sent in questions, so we're going to invite you to ask any of those questions if you want to, or any other questions, or you're very welcome not to ask questions at all, but to make comments, speeches, polemics, disagree with people. So who would like to start? EK.
You're from Chinese University of Hong Kong. I enjoyed the presentations of both Ms. Young and Mr. Clayton about right touch. And the question I'd like to ask is, I think, Harry, perhaps you could expand a bit on right touch regulation, not just in terms of the formulation, but also the enforcement strategies. I think what Mr. Young presented was quite interesting in terms of a lot of regulatory compliance requires the agreement of the people being regulated. As you quite rightly said, the regulator will never be there when something happens. I think from industries, not just in many industries, I think there have been a lot of research done in environmental industries about how the sort of right touch in terms of enforcement can increase the effectiveness. And even in the public sector in Hong Kong, we have a very, very unique corporation called the Independent Commission Against Corruption. It was set up about 30 years ago. It's very effective. And they don't depend on complaints. They actually go out and they work with all public corporations to develop ways in which we can't accept sort of advantages. And those are ways that you really minimize the risk of corruption. And Hong Kong is one of the best systems in the world where they actually go out. So it's not just education, but also working with the people regulated to develop those standards that are required. And so that's one element, I think, which I think the PA consultant threw up. So I'm just wondering, in the context of the regulatory bodies, what are your own thoughts about this enforcement strategies?
Okay, thanks. I will come to Elliot. I think, and this does relate, I think, to what Malcolm was saying this morning, so he may also have a view that our enforcement strategies must depend very much on what we're trying to enforce. Clearly the model of, you're talking about of the Corruption Commission in Hong Kong, which is a kind of proactive, engaged organisation with a great deal of power to intervene, is a very strong one. Most of our professional regulators don't have that level of power to actually intervene. They have only quite a complicated and often very legalistic power to apply conditions to health professionals, or to suspend, or to remove from the register. So professional regulation tends to be a pretty blunt set of tools when it comes to quality improvement. And it does seem to me personally that one of the mistakes we made in this country was imagining that regulation was going to be an effective form of quality improvement as distinct from a definition of the good enough. And I know not everyone of my colleagues agrees with me on this, but you know, when you join the register of a professional regulator, it's only because you're good enough. It's not because you're better than other people. It's because you're good enough to join the register. The one just below you wasn't good enough, and they're not on the register, and they didn't get qualified. And the one just above you may be slightly better than you, but basically you're all good enough. So I think it's quite an important distinction to be made between regulation as a bottom line and regulation as an improvement activity. So I'll throw that fairly controversial thought in and see if Elliot wants to. You've got a mic, haven't you? So
yeah.
Come in.
So no, I think it's a good point you make there, and I think we do look to other different sectors there. You mentioned about not being there when things go wrong, and that's why in terms of that maturity curve, you saw at the top there was cultural acceptance. So that's really about, as a regulator, how do you work with those that you do regulate to make them to make them understand the issues they face, but also they have the ability to flag up if they don't feel happy about things. And there are some regulators out there that work with the professions that help people through difficult times in their career. So it's a balance to be had between prosecuting bad behaviour or dealing with it, but also having the ability for people to feel as they can reach out, that it's their own career development you're looking to help them with and help them through a difficult period.
Malcolm, Margaret, do you have anything to add?
Can I just say that I think the ultimate goal should be self-regulation, where we ourselves as professionals where we don't need to be having people looking over the shoulder all the time. And I would say that, again, as you've said it rightly, calls for more interaction or more participation of the professionals, those who are being regulated, in coming up with the standards, because then they'll be able to own those standards, and self-regulation, I think, should be where we're going.
I heard concern in your question, that this agenda somehow, if we're not careful, somehow damages our capacity to take vigorous enforcement action when it's warranted. And I think you're right to be concerned about that. The right touch regulation is an enormous relief because it's an R rather than an L. The light touch regulation as the default presumption is part of the European better regulation movement. For those of you from other countries, the Canadian smart regulation movement was similarly motivated. In Australia, the current Abbott government has a very strong, they call it deregulation agenda. And all of these movements are driven by industry and pro-economic prosperity side of government. They mostly fail to engage regulators at all, which is tragic. And in fact, in some parts, sometimes they seem to engage in the worst kind of hypocrisy. They make rules for regulators without understanding the regulator's life. Well, that's what they accuse the regulators of doing. So that's a little bit strange. But when all of the language turns to enforcement as a last result, preference for light touch regulation, or even if you say self-regulation is the long-term goal, there's a group of people in the organization that are terrified because they thought they heard executives say, we don't do enforcement anymore. And they hear that message and will act on it and stop doing enforcement. And that's where, I don't know if you noticed it this morning, I glossed over it quickly. The predictable phases in the emergence of craftsmanship include a massive drop-off in enforcement outputs because of the careless use of language. And it's only when the enforcement outputs and judicial referrals drop to nothing or some scandal emerges that we hear the public voice. You said light touch regulation. What on earth were you thinking? And it turns out that now you've lost your teeth. You don't have the capacity. So right touch regulation is exactly right. The set of principles that Harry put up, I think, is very comforting, and there should be nothing offensive or worrying in it for the enforcement folk. But the enforcement agents are less utilitarian than many other parts of a regulatory operation. They have a sense of justice and morality, and that they are on the side of the angels against evil. That's a very different frame of mind than getting the outcome that you want at the minimum possible cost. They are interested in symbolic enforcement. They are interested in punishment because it has a place. And we must be very careful not to lose our capacity to be really sharp when that's the right way to behave.
I think that fantastically insightful, Malcolm. I could see my legal team nodding and smiling when you said they like punishment. Please.
Thanks. John Jenkins, working with the Irish Medical Council. And I just want to pick up on the point that Malcolm just made and to reflect back on what you said, Harry, where you described right touch regulation as a framework within which professionalism can flourish. So how can regulators balance those two things? And do we have good examples? Can the panel give examples of regulation where we have managed to balance those two things, particularly from the perspective of those being regulated, where they begin to see their regulator not just as the big stick, but also providing that framework within which they're encouraged to develop their own professionalism?
Who'd like to have a go at that one? Maybe someone from the audience would like to answer John's question. Well, I'll give you a bit of an answer, John. I think that what I mean when I say that is that regulators should set standards that are in tune with the grain of the profession. And it's really Margaret's point about, I mean, there's an interesting thing, isn't there? And I think Professor Graham Cato, when he was chair of the GMC, used to say that the standards of the GMC were kind of your conscience, the conscience of the professional. And so I think there is a way in which you can combine the professional person's judgment operating within a framework that acts as consciousness, and then the punishment side is when you transgress way beyond the boundary of that set of standards. And I think most professionals actually recognise when that transgression is so significant that real action should be taken. But there is a debate between the regulators here. I know, I mean, having worked with colleagues in New Zealand in particular, where there's and Ron Patterson's work on remediation rather than punishment, rather than retribution as part of the regulatory framework. I think there is a debate being had between regulators about what's the best way to get this balance right. So, Marilyn.
I can just give an example of where the profession has benefited from regulation. We know that many health professionals, doctors particularly, know those doctors who are incompetent, causing harm. And in my lifetime, many have not reported when they should, even sexual abuse, misconduct, gross incompetence leading to serious harm to patients, because they feared defamation, they feared, resentment from peers or whatever. When we introduced mandatory notification, it was great relief to the health professionals to be able to say, I have to do this by law. The regulators require me to report because, one, I have to, otherwise I'm in trouble. But it actually reintroduces the idea of professionalism and ethics into care and putting the patient in centre. So I think that's a good example.
Thank you. Shane.
Michael from the GMC, just to come back to Dr. Cayton's point, largely with thanks to Neil and our council, both past, Dr. Jenkins is part of it, and current, we've been able to invest in a number of regulatory interventions across that continuum, Harry, from quality control to quality improvement. And on the quality improvement point, there's a couple of interesting posters I would invite you all to go and have a little look at about a number of outreach services that the GMC has put in place to provide doctors with on-the-ground support around our professional standards and what those actually mean and how to put those into practice in their day-to-day practice with patients. When we implemented the service and the offering, we thought no one would want to see us. Your regulator turning up, talking to you about professional standards. We've seen 15,000 doctors in the last 12 to 14 months. We cannot meet the demand. And what we're hearing is doctors want us, Neil's language, to be on the pitch, and they want us to explain the rules of the game, and they want us to help interpret that. And even more interestingly, they tend to listen, because Professor Sparrow says we get our legitimacy from our the range of our regulatory functions. Revalidation is nudging doctors into a more active consideration of their practice. Fitness to practice is always there. So I think thinking across the regulatory continuum from quality control to quality improvement, which is something Anna van der Gijg often reminds me, there is some good stuff working there, and there's 2 or 3 posters of the GMC. I'd be very happy to take anyone through after.
Thank you. Ron?
Ron Patterson, New Zealand. This balance between putting all our eggs in the basket of external regulation, and my colleague Charlotte Paul from New Zealand writes of this, and of the risks of going too far down that path. And so tomorrow we'll hear from Honora O'Neill, who talks about the need for an intelligent accountability. It seemed to me that in a role somewhere like Marilyn Walton's as the Health and Disability Commissioner, that in part the role, and I think of Harry's work in PSA, and part of that role is to hold a mirror up to the professions, in which the professions say, well, we set these standards. Have you met these standards you set for yourselves? And then to balance that, and I think of Stephen Dorrell last night at the House of Lords, as the former chair of the Health Committee, talking about the importance of having that accountability ultramontane. So he talked about the way in which you had a setting of a public accountability through those hearing processes, ways of keeping our regulators honest.
Thank you. Over here.
Hello. Hi. Tim Aldrich, KPMG. Very interested to see outcomes come out in Harry's presentation. One of the things that I've sensed throughout the conversation today around risk is that it's very easy just to sometimes leave the outcomes to one side and to focus just on the harm. But I'm interested to know what people think about how outcomes can play a role in quality improvement. So is there a distinction between harm and higher public outcomes than just sort of meeting that standard? I think that's partly to Harry, but also to Malcolm and Elliot and Margaret too.
Okay, thank you. I'm going to take one more, and then I'm going to come back to people.
Thank you each for your very compelling presentations. My question is to Elliot, and if there are comments from the others, I'd be grateful to hear them. Elliot, you commented on collaboration as being a key to productive regulation. My question is, collaborate with whom, and what is productive regulation?
Shall I answer that now? So I think, as I indicated in the presentation, it's about collaboration with those that you regulate, but it's also collaboration with other regulators and other government stakeholder bodies, I think, and other organisations. The reason I say that is because it's about the environment, the context you work within, and I think as regulators we need to think about not just in terms of the profession we work in terms of a narrow channel in terms of the services they provide, but the context, the environment they work within in total. So certainly in terms of aviation, one of the things that's interesting there is looking at the context about where pilots operate, looking at economics and the pressures applied to them. So I think it's incumbent then to work with other organisations to understand the context, the environment you're working within. I think it's a really important factor to be. So don't get me wrong, it's not just about collaboration between those that you regulate, but collaborate with other parties, other regulators in your sector to say, can we join up our data sets? Can we look at trends? Can we look at economic pressures in the areas that we're working within to say, actually, there are things we should be focused on now?
Can I ask Malcolm and Margaret if you just reflect on that theme that came out about internalised and externalised value?
I think the question goes to the nature of the relationships that regulators have with regulated industry. The classic schizophrenia for a regulator, you wake up in the morning and ask yourself, today do I want to be loved or do I want to be feared? Neither is right. You want to be respected for your mission-centered view of what you're about, and your relationship with the industry you regulate needs to reflect that. Now, the American tradition is adversarial, as I mentioned, and we learned very long ago how unhelpful that was if you push too hard or in the wrong places and basically make yourself unpopular. It's also very inefficient. But the antidote to adversarial relationship tended to be client service orientation. We're here to help. How can we help you? And now that's just fine on areas where the incentives are perfectly well aligned, which is a small subset of the risks. And it fails miserably on everything else. So the correct basis for the relationship is a focus on your risk control mission. Now, this is a peculiar relationship, and it's a bit of a surprise to some people how this interaction is going to work, because the regulator is going to show up and knock on the door and say, I'm here today because I'm working on this risk. You're involved. Our data shows us that. We're really interested to hear your contribution, your perspective on the problem, any data that you have available, what you might do. And there's a number of ways that we can deal with this. We would like you to work with us. But if you don't work with us, we're going to do it anyway. And you won't like that so much. That might involve enforcement and other methods. Now, that's an absolutely mission-focused basis for your relationship. And that ought not to hurt them if they're well motivated. It should be thoroughly constructive. I have something to say on the outcome question too, but maybe we should deal with this one first.
Move on to Margaret and then...
Well, just to sort of say that the World Health Professional Alliance, which is a world alliance of, at the global level, of physicians or doctors, nurses, physiotherapists, dentists, and pharmacists, have begun to have meetings, which we have every year for the last few years. We've had meetings where we're actually trying to change the perceptions and change that line that divides up regulators, from the providers or the professionals, those who are being regulated and those who are regulated, so we can begin to look at each other with a less suspicious eye at each other and see how we can work with working towards the same objective, which is patient safety. And I think we are moving along in that vein, and I think it's working out quite well. But though, of course, we need to get it down to the national levels and in countries and down to the grassroots. But I think that should change. I would imagine that would change a lot in terms of people beginning to talk to each other. Traditionally, in so many of the parts of the world, the government regulated health providers. And I think governments are still trying to hang on to the regulation. We need to be looking at what you're saying is you have the users, you have the providers, you have the employers, but to what extent do employers play a role in the regulation? And this is something that we need to be discussing. I don't know if it fits in this particular session or is something we could talk about.
I'm sure we can come back to it and talk about it in the groups as well. Malcolm, I'll let you just...
I also wanted to just say that as we do that, then we know that we're all looking towards professionalism is what our goal is. And then you begin to look at each other more of members of our own team instead of looking at each other suspiciously from across the fence and saying, you're the regulator, we're the providers, you're regulating us, we don't want to be regulated. And so you begin to look at ourselves as working towards the same goal, which I think is a good process. So collaboration is a good process. As for collaboration outside the sector, you know, my own reservations about that.
Malcolm, a final point on outcomes?
It's a fascinating question and a deep and rich subject. The relationship between the story that you can tell and the way that you worked. A focus on outcomes in the risk control business is one of the major drivers that pushes people towards explicit recognition of their need to focus on risks. It happens like this. If they're brilliant functionally and process-based, those two forms of work produce their own natural metrics. If you're running an audit shop or doing an inspection program, you can count how many you did and the quantity, and hopefully you've got a quality metric as well that says something about professionalism and relevance. So you get quantity and quality out of a function. From every process, there's 5 categories of metrics. You have the volume coming through. That's not really under your control. That's something that happens to you. You've got cost efficiency, see how much it costs you to process all of these complaints or applications or referrals. You've got timeliness because you've got mandated deadlines to meet. You've got accuracy, you like to make the right disposition earlier rather than later because it's cheaper and more comfortable for everybody, rather than waiting for an appeal or review. And on the end of every process is a client. So you can also do client satisfaction. Those are the 5 types of metric you get out of any core high volume process. And what agencies realize eventually when they're brilliant at functions and their process machinery is beautifully oiled, what have you told me about whether the world is safer or cleaner or healthier? Answer, 0. You can excel on these 2 fronts and have nothing to show in terms of outcomes, which is what then challenges the organization. You know, how are we really going to be able to demonstrate that we control risks?
Absolutely. Okay, well, that's the end of this first Q&A.